Hi there, we're going to talk about his morning routine. Good morning, Cody. His mornings, for whatever reason, he wakes up maybe 3 days a week, pretty agitated and in some pain, and his gastro pain just really manifests in the morning. Don't know why, but he'll sort of lay down, sit up, slap his leg. Sometimes he'll knock his knees together. He'll hyperventilate. As it goes, sometimes it'll escalate into some seizures, some little seizures. And so if he wakes up that way, kind of a hot mess, I'll sort of watch him for 15-20 minutes. Sometimes he'll have a bowel movement and it'll kind of be over with. Other times it just continues and he doesn't do that. So I will kind of watch him for a little bit, and if it's to the point where it's kind of leading into some smaller seizures, I don't want him to be in pain, and I don't want him to be distressed. Quality of life is what I care about. So we'll do the small dose of hydroxyzine in those situations. It's a trade-off, right? Because you don't really want him to go into some seizure activity and wind up with a seizure cluster and rescue meds. So this is a better alternative, and it just helps him relax and not be in pain and stress.
I know.
And we're working on the pain part, but it is what it is right now. It just seems to be his new normal for the last year. So that really helped calm him down and allowed him to, he's awake, but he's very calm. So that's when I would come in and change all of his diapering, and I would put a new Polymem if he needed one with some zinc, and the diapering, of course, you're going to do, this for the zinc. And I'll cover his vesicostomy area with zinc, and change his shirt if it's wet, change the chuck pads if they're wet. Sometimes because of gravity, the urine overnight when he lays on his left side, which he tends to do, it'll kind of drip out, and so you want to look for that. We wash his face gently I just use a baby wipe. I should say though, I don't wake him up. Sleep is paramount for people with mitochondrial disease. It's an energy disease, so that's the only time he gains energy, is when he sleeps. So I let him sleep, unless he has a messy diaper or if he's soaked from urine or whatever. Probably won't happen as much when there's a nurse overnight. That's when I sleep and he's on his own overnight here. Unless there's meds that are due, and I a lot of times will give the meds an hour late to give him rest and not bug him. But those are kind of the times I'll intervene. Otherwise, I try to let him sleep whenever he wants to sleep, whenever he shows that he needs to. So I do a face wash, meds, obviously. Oh, and then mouth swabs. He has pretty bad dry mouth in the morning, and so I would do a mouth swab immediately, and then probably another one 10 minutes later, just to give him lots of moisture in there. You can use the mouth moisturizers, or he loves juice, cranberry juice is his favorite. That's helpful. And that's kind of his morning routine. He often, because he gets seizure meds at 9, he'll often sort of drift back to sleep, which is also a good thing for him. And that's how Cody starts his day. You can always feel free to give me a call and ask me when that boundary is, about when would I give him hydroxyzine versus just let him be in the mornings, and I'll help with that. But I mean, it's really as you get to know him intuitively, you can sort of tell when this is super hard for you. That's when I give it. And certainly if it moves into some seizure activity, that's also a boundary. If he was having some seizure activity and not super agitated and distressed, I don't know that I would give hydroxyzine, because it's specific to anxiety. So there it is. There's Cody's morning routine.